name's Zerby, and I'm going to be doing catheter insertion today. So before anything, we're going to check to make sure that the order is accurate, that it's for this patient. And then we're going to do hand hygiene. We're going to gather our equipment, which I've already gotten over here. We've got the tourniquet, the transparent dressing, we've got the stat lock for stabilizing the catheter, we've got the normal saline flush attached to the J-loop already, and it's primed and ready to go. We've got the 2 gauze pads, the 2x2s, and we've got alcohol swab or pad. We've got some gloves, and then we have our catheter, IV catheter, and it's a 20 gauge, and we know that because it's pink. And we're ready to go ahead and start our process. We're going to provide privacy for the patient, and then we're going to ask about whether the patient is right-handed or left-handed. This patient is left-handed, so we're going to start with the right hand first, assessing from hand to shoulder. And if we have to move to the left, we can, but we're always going to start off with their non-dominant hand. So I've assessed the patient's veins, and I've chosen the basilic vein right here to do today. And like I said, we've already got our catheter chosen out. It's pink, 20 gauge. We're going to clean the site with alcohol swab. We're going to go ahead and apply our tourniquet. Okay. And we're going to go ahead and bevel up. We're going to go in at a 30-degree angle until we see a flash of blood, and then we're going to go in at a 10-degree angle. So 30-degree angle first. I've seen a flash of blood. I'm going to advance the catheter at a 10-degree angle, just a little bit further with the needle in, and then I'm going to advance just the catheter. Place my thumb on the catheter to prevent it from having a backflow of blood. We're going to remove the tourniquet, and then we're going to clean up any blood that may have dripped. We're going to then connect the J-loop to the catheter. Okay, it's connected. And then again, if there's any driblets of blood or anything, we're just going to clean that up. We're going to stabilize the catheter with the stat lock. Okay. It's secure. Then we're going to apply our transparent dressing. So make sure that IV does not move. And then after we've stabilized it, we're going to check for blood return. So we're just going to slightly aspirate it. I see blood. It's okay to go ahead and flush that IV to ensure patency. And then on the dressing, we can mark the date, time, and our initials. We also need to chart those things. We need to chart stuff like patency of the IV, the size, which was a 20 gauge because it's pink. We need to chart the dressing that we used, any issues or complications we had while inserting the IV, like difficulty to flush the IV, or if the IV is leaking, the position that we inserted. We also need to document how the patient tolerated it, if they tolerated it well or not, and then how many attempts that we took to insert that IV. And then lastly, you're going to want to dispose properly of your needle in the sharps container and your bloody tissues into the biohazard disposal.